Hey guys, today let's learn about the anatomy of thyroid gland. The thyroid gland is an endocrine gland situated in the lower part of the front and sides of the neck. It regulates the basal metabolic rate, stimulates somatic and psychic growth, and plays an important role in calcium metabolism. Situation and extent. The gland lies against vertebra C5, C6, C7 and T1, embracing the upper part of the trachea. Each lobe extends from the middle of thyroid cartilage to the fourth or fifth tracheal ring. The isthmus extends from the second to the fourth tracheal ring. This right here is the isthmus. Dimension and weight. Each lobe measures about 5 cm into 2.5 cm into 2.5 cm, and the isthmus right here is 1.2 cm by 1.2 cm. On an average, the gland weighs about 25 grams. However, it is larger in females than in males and further increases in size during menstruation and pregnancy. Capsules of thyroid. Number 1. The true capsule is the peripheral condensation of the connective tissue of the gland. The false capsule is derived from the pretracheal layer of the deep cervical fascia. It is thin along the posterior border of the lobes but thick on the inner surface of the gland, where it forms a suspensory ligament known as ligament of Berry, which connects the lobe to the cricoid cartilage. Parts and relations. The lobes are conical in shape, having an apex, a base, three surfaces which are lateral, medial and posterolateral, and also two borders, that is anterior and posterior. The apex is directed upwards and slightly lateral. It is limited superiorly by the attachment of sternothyroid to the oblique line of thyroid cartilage. The apex is related to superior thyroid artery right here and also external laryngeal nerve. The base is at the level with the fourth or fifth tracheal ring. It is related to inferior thyroid artery and recurrent laryngeal nerve. The lateral or superficial surface is convex and is covered by A. Sternohyoid muscle right here. B. Superior belly of omohyoid right here. C. The sternothyroid right here. D. The anterior border of sternocleidomastoid right here. The medial surface is related to two tubes which are trachea and esophagus, two muscles which are inferior constrictor and cricothyroid muscles, and two nerves which are external laryngeal and recurrent laryngeal. The posterolateral or posterior surface is related to the carotid sheath and overlaps the common carotid artery. The anterior border is thin and is related to the anterior branch of superior thyroid artery. The posterior border is thick and rounded and separates the medial and posterior surfaces. It is related to inferior thyroid artery, anastomosis between the posterior branch of superior and ascending branch of inferior thyroid arteries. Parathyroid glands. Thoracic duct only on the left side. The isthmus connects the lower part of the two lobes. It has two surfaces which are anterior and posterior. and also two borders, which are superior and inferior. The anterior surface is covered by the right and left sternothyroid and sternohyoid muscles, the anterior jugular veins, and also fascia and skin. The posterior surface is related to the second to fourth tracheal rings. The upper border is related to anterior branches of the right and left superior thyroid arteries which anastomose here. Lower border. Here, the inferior thyroid veins leave the gland at this border. Arterial supply. The thyroid gland is supplied by the superior and inferior thyroid arteries. This one right here is the superior thyroid artery arising from external carotid artery. Venous drainage. The thyroid is drained by the superior, middle and inferior thyroid veins. This is the middle thyroid vein. This is the superior thyroid vein. And also this one right here is the inferior thyroid vein. Lymphatic drainage. Lymph from the upper part of the gland reaches the upper deep cervical lymph nodes either directly or through the prelaryngeal nodes. Lymph from the lower part of the gland drains to the lower deep cervical nodes directly and also through the pretracheal and paratracheal nodes. Nerve supply. Nerves are derived mainly from the middle cervical ganglion and partly from the superior and inferior cervical ganglia. These are vasoconstrictor. Clinical anatomy. Number 1. Any swelling of the thyroid gland is known as goiter. It should be palpated from behind. Number 2. Removal of the thyroid gland is called thyroidectomy. With true capsule may be necessary in hyperthyroidism. Number 3. In subtotal thyroidectomy, the posterior parts of both lobes are left behind. This avoids the risk of simultaneous removal of the parathyroids and also of postoperative myxedema, which is caused by the deficiency of thyroid hormones. Number 4. During thyroidectomy, the superior thyroid artery is ligated near the gland to save the external laryngeal nerve, and the inferior thyroid artery is ligated away from the gland to save the recurrent laryngeal nerve. Number 5. Hypothyroidism. It causes cretinism in infants and myxedema in adults. Number 6. Benign tumors of the gland may displace and even compress neighboring structures like the carotid sheath, the trachea, etc. Malignant growths tend to invade and erode neighboring structures. Pressure symptoms and nerve involvements are common in carcinoma of the glands.